Welcome back. Well, we have the doctors from 7-Day Dental, Christine Chung and Chuck Lee. Always good to see them. And today, you sent me over some before and after photos about different things that you have done, which, when we bring those up, really showcases the dramatic difference. Am I right?
Yes.
Yeah, it really is. And I know that all kinds of different things were probably done here. And we are seeing, I mean, you look at this first one and look at the dramatic difference. So explain this to me. As far as what was done, it looks like it was done over a different, the top teeth, and I don't know if the bottom teeth were done here.
No, the bottom teeth were not done.
It's still in a temporary state.
Yeah.
Oh, okay.
This patient came in and we told him, look, you've worn down your teeth, you're a grinder.
Yeah.
And one of the main reasons she's worn them down so much is she just had a bad bite, and also she had some problem, throwing up.
Really?
When she
Okay.
was
Reflux.
young.
Oh,
Reflux.
Okay. Sure.
And so you could see that all the enamels have been eroded. But the worst thing is, she's an older lady, and nobody ever shared with her that, look, your teeth you're damaging your teeth.
Right.
So she came in. What we have to do in this case is, first of all, we got to make sure that we work up the gum situation, make sure the gum is healthy.
Right.
So we got her into good health with a periodontal, and then we had to do crown lengthening, which means we made the teeth a little longer. Okay, so the upper teeth, we trimmed the tissue back a little bit so that we can make the teeth a little longer. And then we made her a set of temporaries that she would use as to kind of try and make sure that her bite she's comfortable with the bite, and she likes the aesthetics. And then once after that, being in the mouth for 3 to 6 months, and the patient's very comfortable with the new set of teeth, form-wise, length-wise, width-wise, then we will go to the final stage of the permanent crowns.
Okay. I see what you're saying.
And this way, she gets to test drive her teeth, and to make sure that we're not seeing any more wear patterns and abnormality. So we're very careful in checking that, because once you get the bite on and the bite is better, she's not going to damage her teeth as much.
Okay. Let me ask you the difference between, so these are temporaries,
Yes.
because they look permanent to me.
Yeah.
But what is the difference between the temporaries and the permanent? Are they still crowns, or how
Yes.
does that work?
Yes. So temporaries, what we do is when we want to build out a case, we do a wax up. The lab will, based on the lower teeth, they can determine what the length and the width should be on the upper teeth. And once you get it proportionally waxed up, then we make temporaries. These temporaries are made out of very hard acrylic, and they're lab fabricated, so they last. They can last up to 2 years.
But as you can see, it's not translucent. It's not that natural yet because of the temporary materials.
Okay.
Yeah.
So.
And I think the picture quality too. It didn't come out as nice on the camera as it's in real life, but the most important thing is she gets to test drive it.
Right.
And now she loves her teeth, and she likes the way they're comfortable when she eats, and they're biting, they're occluding white. She's comfortable. Then we go to the next step, which is to make the permanent very much like the temporary, except it'll be more cosmetically inclined. It would be more texture and layered, so that it looks more real. So,
As you can see, it's a big improvement from what she came in, and at this state of temporary. She looks just more youthful.
Yes, she does.
Do you think? I mean, we cannot show her face, but as you can see, she has more lip support.
Right.
It shows more teeth rather than gum, and more proportional. She has more smile now.
And people always have to remember, anytime you can because when you're younger, your teeth are longer. So as we age, our teeth start to,
Just wear
get
and
small,
tear.
wear and tear. So if you can give them the height back, it makes them look a lot younger.
Sure, that makes sense.
So in this case, I want to emphasize that it's not just the age factor. You know, we can treat anyone based on their dental condition.
Okay.
Usually, I would like to catch this like 50% more teeth, because then you could see the wear pattern, you could see the damaging factors, but then you don't have to do so much like lengthening the teeth to get some more height to the teeth, you know. And if you can catch it early, it's more conservative. It's going to be less invasive, and patients will, enjoy it more at an earlier stage. But usually, people that at that early stage, they see the pattern, but they're not, because it's not so bad yet, they'll rather wait.
Right.
You know.
Yes.
All right, let's move on to the next photo here. And this one's sort of an obvious problem here.
A false tooth.
Yeah.
Yeah, she's a younger patient, and we were able to do a single implant on the front tooth. After bleaching and get her gum to a nice state, she was ready for an implant. Just single implant.
Yeah.
And then I think we also did her adjacent crowns to make it match.
Okay, yeah, you can see the difference.
Yeah. So in these kind of cases, we always let the patients know that they have options. First of all, I always ask them, do you like your teeth color? Do you want, because anytime you do a front tooth is a time where you have to say, which color of your teeth do you like?
Right.
And you get them to be the whitest color that's possible prior to jumping into restoring it.
Okay.
And then we give them option between a permanent bridge versus an implant and some crowns.
Okay.
Yeah, so she opted to do implant because she didn't want to lose any more bone in the area.
Right. Yeah, that makes
anytime
sense.
you pull a tooth, you're going to lose bone in that area if you don't do anything. So.
And here you can see not only the obvious color difference, but I can see here were those crowns that were put on?
Yeah.
Or, okay.
Well, the other two are dead tooth. They had previously root canal, so that's why they turn color.
Oh, really?
And becomes yellower than the rest of it. Plus, the gum line, as you can see, is all over. So we have to do some corrective tissue at the gum line.
Okay.
To get a good uniform high smile line.
Okay.
And then we bleach the teeth to make sure that we get the same uniform color before we can crown them. So it's
yeah, I can see. I mean, the difference is remarkable.
And I think you can notice that they're now proportionally equal.
Yes.
Before the two side teeth, the laterals were a little bit too small. They're called peg laterals, and they were a little too small. And now the four crowns, it looks very natural, you know. So if we were, I mean, we could have just done two crowns, but it wouldn't have made much of a difference.
Yeah. All right, we'll go on to the next photo here, and it looks those were old fillings versus new.
Yeah, we've done quite a bit of transforming a non-silver mercury filling to composite resin porcelain restorations. And many times we've seen amalgam, they tend to expand, so they do fracture. Patient comes in all the time and say, oh, I just broke my tooth. And so we want to do a lot of preventative, more so than wait for things to happen. So we replace those big old silver filling, and believe it or not, most of the time we see recurrent decay underneath there, because fillings over the years, they tend to leak, and then bacteria would seep underneath there, cause more decay. So we wanted to prevent from getting the worst scenario, like a large decay that goes into the nerve that we have to end up doing root canals, or like in this case, all we need to do was just a direct composite resin fillings, or just a very small partial crown, not a full crown where we have to grind so much to structure away. Okay.
All right, we got to move along a little quicker here. Let's go to this one.
Again, we have some attritions or awareness of the front teeth, and some contouring of the gum, and then we crown the six teeth, I believe.
Yeah, So this is a case where I would say this is where I like to catch them a little earlier.
Okay, like where you're talking
Yeah,
about.
see, you could see the wear pattern. You
Right.
can see that the bite is it's only gonna get worse. So we were able to do it, and the patient's gonna get to enjoy it more because
Right.
they're a little younger, and if they wait too long, then it's more
And also,
damage.
I wanted to say that in this case, we were able to do it in a way that the patient can afford financially.
Mm-hmm.
Because sometimes when we do cosmetic, you're talking about replacing crowns or veneers from
Right.
here to here, the smile line. So a minimum would be 8 or 10 crowns.
Mm-hmm.
But for him, we were able to do just 6, and it's a big improvement already.
Right.
Yeah.
And we'll look at the last photo here. I think this one you've shown us once before. Is this? Yeah.
This
got
one
before and
is
after.
very
I see
interesting.
it.
He came in and he said, I want to have perfect smile.
Mm-hmm.
And so he knows that he needs braces. That will
Right.
be a long time from now. But he's in the showbiz. He's do a lot of video shooting and pictures
Okay.
and photos. So he said, I want immediately results. So we have, it's called a smile makeover. Where we just take the impression without grinding any teeth, and we were able to do a snap-on smile. So these are snap-on from all the top 10 teeth that it covers. It's removable. It's more like a temporary thing for him to do a video shoots.
Interesting.
But without grinding any teeth and all that. But he knows he needs to come back to do braces or crowns of veneer to fix that. But this is very, very, interesting, and he loves it because he said, oh my God, you're transforming from this to this with no time elapsed.
All right.
Yeah.
Very good.
So-
Great before and after photos.
We're here
Yeah.
for you. If anything you feel like you need to have a consult, give us a call.
Yeah, definitely. You can see all the different things that can be done. There's not just one option.
Yeah, and don't worry. I know these are cosmetic. If there's no insurance cover, we do give out discount.
Great.
We work with you. We have payment plans. We do anything that you can afford to get a better, healthier, perfect smile.
All right. Thank you, Christine Chung, Chuck Lee. 7daydental.com. It's easy to remember. The number is 949-859-3988. Good to see you. Great photos.
Thank you.
We appreciate you bringing those by, and we will be right back.
Thank you.
It's fun.
Thank you.
Yes, it's true. 7-Day Dental has the best doctors and great staff. 7-Day Dental is giving all senior citizens a complete exam for this month only, including x-rays for only $35. You heard it right. Only $35 for exam, including x-rays to all senior citizens. Go to 7thdaydental.com to find the location nearest you. 7daydental.com, where smiles are born.